Welcome back, guys. Today we will discuss about geriatric consideration in psychiatric nursing. Geriatric consideration means what? That we will discuss in this video. Geriatric means a branch of medicine deals with the study of elderly people's care. Elderly in the sense 65 and above years old. And what is geriatric means old age, and the word geriatric comes from a Greek word called geras, and gerontology means the science of aging. While considering the geriatric patient's concerns or assessment, there are some things you have to focus on, you have to do. Among that, first thing is primary assessment. Primary assessment means the overall assessment of the patient and the general appearance of the patients, etc. After that, you can go for history collection. In the history collection, you have to do proper history collection. In the history collection procedure, what are all the things we have to follow? Everything you have to follow. After history collection, you can go for secondary assessment. In the secondary assessment, you have to do proper secondary assessment. That means what is the medical complaint of the patient, psychiatric complaint of the patient, everything you have to assess. Then you have to check the transport and movement capacity of the patient. That is very, very important, or that is very important part of geriatric patient assessment. Then medical assessment, medical condition, present medical situation of the patient, that you have to assess. Then environmental and social assessment. Environmental stage, in from which kind of environment they are coming and from which type of society they are coming, that also you have to assess. Then a research result I will tell you right now that shows what is the importance of geriatric consideration. According to survey and research, in 2015 there were 47 million Americans over the age of 65, and in 2060 there will be 98 million Americans over the age of 65, and this study is conducted in US, and this is the situation everywhere in the world. A number of old age people is getting increase day by day, and so in this way, if we think the care of the old age people is literally a challenging thing. So there are a lot of things you have to take into your consideration while dealing with a geriatric patient or old age patient or a person. Then major geriatric concern, that is our point today. So what are all the concerns you have to keep it in your mind, or what are all the things you have to take care while dealing a geriatric patient? Among that, first thing is age related difference. For each age group, different type of concerns will be there. So age, you have to consider the age, that is very important. Then type of medications they are taking, each group is taking, or almost all elderly people are taking different kinds of medication. So what type of medication they are taking, either it is for a medical condition or it is for a psychiatric condition, that you have to understand properly, you have to analyze properly. Then chief complaints of the patient, what is the present complaint of the patient, because you need to give more focus and you need to give more attention for that particular point. So chief complaints, that is the other concern. Then signs of elder abuse, and this word is very familiar to everyone. Knowingly and unknowingly, most of the old age people are getting this abuse or affecting or facing the abuse. So elder abuse signs, that you can understand through physical examination as well as through the therapeutic communication. Then neglect is also a part of geriatric consideration. Most of the old age group people are facing this neglect from their family, from the society, from the place where they are staying. So signs of neglect, that also you have to assess through the mental status examination, through the communication you can assess that. Then communication and barriers, communication problem, that is another problem. Their ability to communicate is getting worse and day by day. So sometimes they cannot communicate or they cannot convey what they need. So communication barriers, that you have to understand properly and you need to give more time to listen their problem. Then functional ability, functional capacity, ability to move and other organs functioning, that you have to assess, that is another concern. Then physical health of the patient, that is very important. The nutrition assessment, all type of elderly patient cannot take the same nutritional pattern. In a group, 10 people is there, means 10 different mode of nutritional intake will be there. So nutrition assessment is very important. Then vision and hearing capacity of the person, urinary problem, bowel problems and osteoporosis, that is related to bone functioning. Okay, so these many things mainly you have to take into your consideration, and these are all the major concern while dealing a old age person. Then what are all the major things to consider in moving and transporting? While moving and transporting a patient, you have to be very careful before going to move and transport a patient or elderly person. You should know, you should learn, you should study how to move, because every person's postures, gestures, gaze will be entirely different. Depend upon that, you have to evaluate the mobility of the patient, and the comfort and safety is very important. Equipment using for the movement is very important. Medications they are using, that is also very important, because while moving you have to check what type of medications they are taking. This type of medication is taking means they have to be they need to be moved in a particular way, that you have to check. Then your patient's warmth and comfort is very important while transporting the patient or the elderly person, and be careful about the surfaces. Slippery surfaces, that means you have to be very careful. Chances of fall are very common, so you have to be very careful, and you should learn the techniques of moving and transporting before going to participate or before going to deal with moving and transport of a elderly. The next thing is mental health concern. Mental health concern is a very important factor. There are a lot of mental health concerns. Major things only I will tell here: dementia, cognitive problems, memory problems, Alzheimer's, and other mental health problems. Dementia and this Alzheimer's are the common thing which we can see in elderly patient. If you use your common sense, you can understand. When you get older, automatically your nerve system will get impaired. Automatically, you will get a difficulty to memorize the recent things and other things which is happening in your life. So that is a very important concern. Memory power of the person or the elderly person, that you have to assess in the proper way to provide proper care to the patient. Apart from that, other mental health problems also can see in a patient, especially in old age person. So other mental health problems also you have to check. For that, you can depend the case sheet of the patient, and you can collect the information from the psychiatrist or the person who is giving care and who is treating the patient. So mental health concerns also very important. Other geriatric concerns include aphasia, that means inability to communicate, then mental status, that means overall mental stage of the person, then coping mechanism, how they are coping with the situations, how they are coping with the stages of treatment, how they are coping with the people, those who are all around them, that is also important. Then the bowel habits and fluid intake, that is also you have to take into your consideration while dealing with the old age person, that is also very important. Next things in the steps in geriatric care, that is very important. Conduct a complete review of the care plan before going to meet your elderly patient. That is very important. What type of treatment they are taking, what is their attitude and adaptation style towards the treatment, that you have to understand and that you have to analyze before going to meet your elderly patient. The next thing is understand the patient's family's concern and patient's family's prioritization towards the treatment, and what is their concerns towards the treatment, that you have to understand in the proper way, and based on that you just prioritize the care pattern. Then do a proper review of care plan. This many things you have to understand and you have to take into your consideration while giving care to a geriatric patient. So when caring a geriatric patient, this disease-centered approach, it is not at all possible. Always patient-centered approach is important. Apart from that, you have to think about the patient and their aspects of treatment plans. That is also very important. You have to check their goals for medical treatment and their goals for quality of life maintenance, etc. So always focus on patient-centered approach, not the disease-centered approach. So that is also very important in geriatric patients considerations. Hope you understand, guys. Thank you.